Good morning. My name is Jasmine Zain. I'm one of the transplant experts. I recently joined City of Hope. I used to be at Columbia University and moved to the West Coast to be a lymphoma transplant person, giver at City of Hope, which is a big transplant center. Today we are actually this is an exciting session. It's about taking charge of yourself, exercise and feel better, do-it-yourself quality of life improvement after a bone marrow transplant. So I'm looking forward to hearing two great talks. Our speakers today, the first one is Dr. William Wood. He is an assistant professor of medicine at the bone marrow transplant program at the Lineberger Comprehensive Cancer Center at the University of North Carolina. He has a research interest in physiologic fitness and quality of life in patients after stem cell transplant, and he'll be giving us a talk, and this will be followed by Tracy Douglas, who is at the Sidney Kimmel Comprehensive Cancer Center and is an oncology nurse manager there. She's been working with transplant patients for the last 23 years and educates patients and families about the importance of exercise throughout their recovery and as a way to manage their life and their fatigue. So welcome, Dr. Wood and Ms. Douglas. Dr. Wood, you want to start? So the sessions are going to be about 30 minutes each, and at the end of, hopefully we'll have some time for questions and answers at the end. So welcome.
Good morning. Thank you very much for the opportunity to talk with you this morning. Thank you to the conference organizers for putting together a wonderful conference, and I feel very privileged to be able to speak today about a topic that is of great interest to me, which is exercise in the context of stem cell transplantation. This is something that I'm actually very interested in from a research standpoint, and it's actually something that my center at the University of North Carolina takes very seriously as well, both pre-transplant and post-transplant as an important part of both preparing for transplant and transplant survivorship. So I'm happy to share a couple of insights from our center and look forward to the conversation afterwards. So today what I hope to do throughout the session is to describe a few of the key issues I think exist around exercise and bone marrow transplantation. And what I'd like to do is I'd like to set the stage first by talking about the impact that the transplant process can actually have upon usual physical activity. And this is something that I think that we know and we recognize both as providers and as patients and as family members, and for many reasons. And now we have ways to actually measure that a little bit and to find some empirical data that supports that, and may point to how and why exercise can actually help to improve that process of physical attrition from transplantation, both in terms of preparing for transplant and in potentially promoting recovery from transplant. I'll spend a little bit of time talking about some practical exercise recommendations that may be helpful for the cancer survivor before and after transplantation. And then towards the end, I'd like to spend a little bit of time talking about bone marrow transplant late effects and what role exercise might have in helping to reduce or improve the severity of some of these late effects, including issues around bone health, stamina, cognition, pain, and mood. So I wanted to start by talking a little bit about what is the impact of bone marrow transplantation on physical activity. And this is something that, again, I think we can recognize there are many, many possible contributors to why physical activity decreases during the transplant process. And as most of all of you know, there are two main kinds of transplants that we do: the allogeneic transplants, which are the donor transplants, and the autologous transplants, where the recipient receives his or her own cells. And with either of these processes, there are multiple varied inputs upon physical activity throughout the transplant process. And I kind of split them up into two main categories. It's just one way of getting at the categorization. One relates potentially to the physical side effects from treatment itself, and as you know, we have a variety of therapies that actually exist to control disease before transplant, which can all have effects. We also have therapies that are part of the transplant process, or the so-called conditioning regimen. This may involve high doses of chemotherapy or radiation therapy potentially. And these different treatments themselves can actually have varied effects upon the body. They can cause fatigue. Sometimes they can cause pain, whether that is musculoskeletal pain or whether that is mucosal pain involving the mouth, the gastrointestinal tract, or elsewhere. These can have effects on muscle mass and bone density, and these effects themselves lead to decreases in physical activity, both in the near term and in the long term. And for donor transplants, as we know, unfortunately, sometimes complications can and do occur, whether those might be related to infections or graft versus host disease, the effects of which of those specific issues, or maybe the treatments that are used for those issues, can also lead to decreases in physical activity. And finally, though I know that there are some centers that do outpatient autologous transplants, our center does do inpatient both auto and allo transplants. And the transplant hospitalization itself can be a source of deconditioning. I think we recognize that when we're in the hospital, usual activity is less than in our home environments. And over time, in addition to the problems that can occur throughout the process or the short-term effects, that simple immobilization can lead to deconditioning and fatigue, processes which reinforce each other and then, again, contribute to decreased activity. So I think we know lots of reasons why activity might decrease during transplant and why we tend to observe this. I've developed some interest, and our center's developed interest in actually trying to measure usual physical activity around the time of transplantation. So this graph essentially is showing the output of an activity monitor, which in this case is a Fitbit, which some of you may be familiar with. There are other activity monitors on the market as well. This one happens to be worn as a wristband and is showing steps per day throughout the transplant process. And what I wanted to sort of illustrate with this particular example is just that there's a lot of fluctuation in usual daily activity day by day throughout the transplant hospitalization process. And while that might be kind of intuitive in general for activity monitors, because some days we tend to move around more than we do on other days, I think what's quite interesting with this is we're showing, maybe not surprisingly, that usual daily activity is correlated highly with symptoms that are experienced during the transplant process. So one of my colleagues at UNC, Antonia Bennett, will be sharing some of these data at the Quality of Life Symposium in Germany in a month. But the physical side effects that we see from transplant seem to be quite linked with the amount of activity that actually occurs during the transplant hospitalization, and then might therefore be linked to some of these fluctuations that we see throughout hospitalization in activity. And overall, activity itself, despite, in addition to these fluctuations throughout the transplant hospitalization, seems to decline over time throughout hospitalization from admission to discharge. And so this is basically a graph here showing, again, sort of a longer-term view, and then the sort of blown-up view here within the transplant hospitalization. And I think what you can see is that this person was really quite active throughout the period before transplant, had quite a bit of attrition and activity throughout transplant, and then had a nice sort of a rebound and recovery here. I should say that this is a pretty biased sample because the participants that were generating these data actually were part of an exercise study, and so people were actually doing a lot of aerobic activity before their transplant. We're working quite hard to try to maintain that during transplant, and we're trying to get back as quickly as possible following the completion of the inpatient hospitalization. And so even though we've not yet done a controlled study where we compare the exercise intervention versus a control group, my guess is that in the control group we would probably see typically even more sort of attrition here in terms of continued reduced activity than we saw within the context of an actual exercise study. But we'll have to see. So I wanted to say a few words about where along the transplant continuum can exercise help. And I think, as we all know, this really is a process. So when we're talking about our patients, we talk about a process that starts at diagnosis, continues through initial treatment for the underlying condition, goes through pre-transplant, and there's actually, I think, an interesting and potentially important window that exists following initial therapy and transplant itself, and this is an area of interest for us and for others. There's a period of time during transplant, and then finally a period of time after transplant itself. And I think that what we know now from multiple different data sets is that exercise in the context of intensive cancer treatment for participants undergoing bone marrow transplants or leukemia therapy, for example, is safe and feasible. And this is something that I know was of concern, appropriately so, to many can you undergo strenuous activity when platelets and white count are low and receiving intensive therapies and so on. And I think now we have a variety of data that shows us that this is in fact feasible and safe without adverse events. So we also have data that suggests that both aerobic and strength training are important components of an exercise program, that exercise intensity can safely range from mild to strenuous depending on the recommendations or the intervention, or obviously the participant for whom these recommendations should be tailored and personalized whenever possible. And we also have data showing that exercise can improve physical function, symptoms, and quality of life. So what do we mean when we're talking about aerobic exercise? We're talking about a type of activity that is sustained, elevates the heart rate, such as walking or running, cycling, rowing, or swimming. I will say briefly that for our own intervention, we've left the type of aerobic exercise completely open to the participant, so long as that participant meets a predefined heart rate target that we're helping to monitor with a heart rate monitor. So that actually might be walking up a hill briskly. That might be it might be going for a jog or on a treadmill. And even within the transplant, again, hospitalization, we, at our center, and I think many other centers are similar too, really encourage a lot of activity throughout transplant, including aerobic exercise, whether that's on a bike or a treadmill or walking around the halls of the unit. And we have several participants who have earned double marathon badges for literally walking the equivalent of 50 miles during the transplant hospitalization. And I think we know that in general, aerobic exercise has a lot of long-term cardiovascular benefits throughout the general population, has very favorable effects on cholesterol, lipid profiles, can improve insulin needs and glucose tolerance, and importantly, seems to be associated with improvements in cardiorespiratory fitness. This is a variable that we've become very interested in recently, the VO2 max variable, which is a indicator of fitness, and we actually have some small data sets, both from our center and from other centers as well, suggesting that actually VO2 max as a marker of fitness can actually help to predict outcomes after transplant and might be a target for exercise interventions along the transplant continuum, both before, during, and following transplantation. So aerobic exercise can be graded as well by frequency, intensity, time, and type, whether that is moderate or vigorous. Many can derive significant benefits from moderate intensity activity. We happen to be doing a strenuous exercise activity intervention, but both are quite helpful for short and long-term health and fitness benefits. Resistance exercise could exist in a number of formats. As you would guess, this has to do with exercise of one or more muscle groups performed against resistance. This might be body weight exercise, resistance bands, free weights or machines, and there are ways to do this, again, in the setting of transplant hospitalization before and afterwards. And we have multiple data throughout non-transplant populations as well, showing that resistance exercise has appreciable benefits, long-term effects in terms of cardiovascular fitness, bone mineral density, and a variety of other endpoints. And this can be done, again, as a frequent exercise, less frequent, one muscle group, multiple muscle groups. There are many different ways one can do this. There are a variety of online resources, which we'll refer to a little bit later, but many centers as well are now developing local resources too, whether those are recreational therapists, exercise physiologists, or others in or outside the center that can really help to tailor a very appropriate, personalized plan for people who may be undergoing or survivors of bone marrow transplants. The exercise physiology community has been familiar now for quite some time with the Borg rating of perceived exertion scale, giving you a sense that actually there are ways to target that sort of sweet spot in terms of how you should be feeling in the context of doing aerobic or resistance training exercise, sort of in that range where you're trying to kind of get into that sort of somewhat hard or hard category, not pushing yourself beyond that point where you may risk injury, and trying to get a little bit beyond the sort of very light and light, so that you're actually generating some short and long-term benefits, whether you're doing aerobic or resistance exercise. Just wanted to allude a little bit to some of the data that we now have. This is a study in terms of pre-transplant exercise. This is a study that was published in Blood a couple of years ago by Dr. Wiskaman and colleagues, looking at 80 patients doing actual home-based exercises that were both aerobic and strength-related for several weeks. The authors found that the exercise group actually had significant improvements in fatigue, physical fitness and functioning, and overall had less global distress. I'd mentioned briefly before that this is something that we're working on now in a 40-person study. We hope to be presenting and publishing these results over the next couple of months. But again, this was a home-based, several-week, 6-week pre-transplant exercise intervention for autologous and allogeneic transplant patients, during which patients actually did fairly high-intensity interval exercise training with a modality of their choice. So whatever that could be, as long as it achieved a target heart rate, and then we followed activity levels throughout the transplant process. And so these types of exercises are feasible and they're safe, and hopefully over the long run will be associated as data accumulates with short and long-term benefits. How about exercise during transplant? This is actually an interesting study I just saw published this last year in support of care in cancer. Actually, it was doing fairly intensive exercise during myeloablative chemotherapy itself, so full-intensity transplants. And exercise seemed to be associated with improved physical performance and physical function, decreases in fatigue, and less cognitive decline over time. Some of you may be familiar with the BMT-CTN 0902 study. I was actually on that protocol team this last year. Unfortunately, it was a negative study, as it turned out, such that exercise and stress management training did not seem to improve the primary endpoint of quality of life in the intervention group. It is unclear exactly why that was the case. It may have had to do with exercise intervention intensity. That's still something that we're trying to unpack as the study group, but that was a fairly large study with a relatively low-intensity intervention that mainly consisted of training as opposed to ongoing monitoring and work on sort of adherence to the intervention itself. So how about exercise during survivorship? There are many potential reasons that this may be helpful beyond the acute transplant hospitalization. And we know that paradoxically, I think this is actually one of the key points to take home, is that exercise can actually improve fatigue. Not only can it lead to less fatigue, but fatigued survivors who exercise report improvements in fatigue. And so it's something about simply starting to move again and engage in a gradually increasing exercise program can actually help to break that vicious fatigue cycle. And we'll talk about that in just a minute. There are also some benefits in terms of appetite, muscle wasting, mood, reduction of bone loss, improved balance, weight control, and overall quality of life improvement. And I think this is a process that one should start early and then try to continue. This was based on some data that we had looking at VO2 max as a variable of fitness that might help to predict outcomes following transplant. And what we found looking at the high and lower VO2 max groups is that the higher VO2 max group appeared to have an improved symptom burden over time as you got farther and farther out from the transplant hospitalization, again suggesting that fitness may be related to outcomes following transplant. And importantly, as we're working on now, fitness may well be a modifiable, intervenable variable such that exercise programs actually improve these fitness measurements. And hopefully what we're going to see is that as we do that throughout the process, we'll both ameliorate symptom burden and potentially improve physical and mental health-related quality of life along the continuum as well. So what can you do before transplant? Well, I think that the first important thing to do is for individuals to talk with their healthcare provider team about their capacity to exercise. And there are a variety of different treatments that patients may have received that can have some cardiovascular side effects, and it's important to know, what is the potential risk going into exercise from a personalized standpoint, which should be something that one's healthcare provider can fairly readily provide upon being questioned. And once there is clearance, there's a bunch of ways that one can start. So we can talk about walking or yoga groups. Supervised weightlifting programs can be helpful, starting again with fairly low-intensity resistance exercises and scaling up from there. But most important, I think, is that the activity is enjoyable, whatever that is. And that's something that we've learned through our own intervention as well. When people find something that they like to do, they're much more likely to continue doing it. So if there's something that's fun and can be integrated into one's daily life, that's definitely what we would recommend. far as intensity, we ask people to listen to their bodies, but if they want to do fairly intense activities, again, we have safety data that suggests that that's perfectly safe in patients who are in the pre-transplant or peri-transplant process. Most importantly, we recommend people get moving and stay moving. How about during transplant? Try to stay as active as you can. Again, we recommend daily activity, even in the midst of neutropenia during myeloablative transplantation. We have folks who are walking and active and reporting it actually is making a fairly big difference in how they're feeling as they're going through their transplant process. We've got light free weights, we have a treadmill, stationary bike, resistance bands, and these things can be mixed and matched depending on the day and what's going on to provide, I think, a pretty satisfying experience that has important long-term benefits. We happen to have a recreation therapist at our hospital. Other hospitals may have similar individuals who can really help to provide a personalized and tailored recommendation for how to stay active, fit, and moving during the transplant hospitalization. We found that to be pretty helpful, but there are other ways to get personalized programs as well. And importantly, and this is something that we reinforce many times as well, it's really important to set realistic goals. So, we do have people that want to come in and they want to be on the treadmill every day, and I think it's important to listen to your body as you go through the process. Some activity is better than no activity, but some days are just not going to be great days, and that's going to be okay. And we're going to recognize that some days are clearly going to be better than others, and some days, if it's going to be a day when you don't really want to do a whole lot, that's perfectly fine, and another better day will come along down the road. And unfortunately, that's as many people can attest to from personal experience. That's a part and parcel of the transplant experience, both in the short and long term after transplant. How about exercises after transplant? Well, I think here's where you can actually begin to improve cardio and strength training as you feel better, again, acknowledging that is a push and pull process over time that may take many, many months before people are feeling that they're back into a place where they really want to start to increase that. Here is where there's a lot of heterogeneity in individuals with their experiences. So people may have issues that relate to platelet counts, corticosteroid use, GVHD infections, and so on. And this is why, again, it's important to just continue to remain in touch for individuals with their healthcare providers to make sure that the program that they're continuing to follow makes sense for them. But so long as it does, we recommend that folks do as much as they feel comfortable doing. We've talked a little bit about activity monitors. We found anecdotally, though we haven't tested it formally, that these kinds of activity monitors can actually be pretty motivating and a lot of fun for people who enjoy tracking how they're doing over time. One can set goals and to say, well, I've been sort of walking 3,000 steps a day in general over the last week. Maybe I'm going to try to increase that a little bit and to use my past performance as an indicator for what I can do to increase gradually activity moving forward. And importantly, again, I can't say this enough, be patient with yourself as you get back to your new normal. This is a process that takes a lot of time, and I think patience is key to finding a program that is really going to make sense. What are people trying to do with exercise in the long run? Survivors of transplants, regain and improve physical function, body composition, improve long-term outcomes in multiple organ systems. We'll talk about that in a second. Exercise, we know, has important effects on mood, and mood can be a serious issue following transplantation. There are lots of reasons to have concerns around anxiety following transplant, whether it's related to the transplant, whether it's related to additional treatments, issues, concerns about disease, and so forth. And exercise, we found, can actually improve those kinds of concerns. If individuals have to undergo additional treatment or want to undergo additional treatment, exercise may boost one's ability to be able to do that safely and successfully. And I think 8 is probably the most controversial, but we are now seeing in other tumors like breast cancer and colon cancer that perhaps exercise actually reduces the risk of disease recurrence. And while we don't have empiric data that's the case for secondary malignancies after transplant, we might hope that that could be the case as well. So we've talked about some of these different things: avoiding inactivity, returning to daily activities as quickly as possible, continue normal daily activities and exercise as much as possible during and after non-surgical treatments, and talk to your doctor to make sure that if you have bone conditions or cardiac conditions, those are being considered as you're moving forward and trying to decide what to do. Remember, the general recommendations are for 150 minutes, which is a lot. I have a hard time doing that myself, I'll admit, of moderate intensity aerobic exercise per week and strength training 2 to 3 times per week. But I think, again, doing what you can and building from there on a week-by-week basis is a reasonable overall goal trying to get to something that approximates that. And I can say that we have a number of folks through our own center who are able to do this following their transplant, though obviously it varies quite a bit on a person-by-person basis. So just a word about the BMT fatigue cycle. This is kind of what I was alluding to before, and we see this all the time at all stages of the transplant process, especially in the post-transplant period. Fatigue leads to changes in physiology, which leads to changes in deconditioning, and that vicious cycle just repeats over and over. And the hope is that exercise can actually break that vicious cycle, leading to improvements all the way along the way, so that this actually becomes a virtuous cycle, and people begin to regain health and improve long-term outcomes by simply introducing, maintaining, and trying to increase an exercise program over time. So we've talked about what goals are like. We've talked about how goals should be reasonable. So exercise physiologists and others like to have this acronym called SMART, which I really like too. Exercise goals should be specific, they should be meaningful, attainable, realistic, and timely. So, for example, you might say, today I'm going to walk to the mailbox and back if you've been quite fatigued and are just trying to sort of get started. Maybe this week I'm going to use some light resistance bands 2 times over the course of the week. Before lunch, I might call a friend and set aside a time to get outside for a walk, 20 to 30 minutes maybe for a light walk. And then you can actually, go ahead and increase that over time. And with the hope is that, and we've seen this, is that as you begin to do these things, fatigue improves and your ability to do more continues to improve as well. And this should be in the slides. I know I'm going to run a little short on time, so I'll be a little bit quick with the last few here, but this should be in the slide handouts. So now let's say that you've kind of gotten going. What can you do to increase and advance your exercise? Well, look at very specific targets to try to increase. Maybe you're going to be doing cardio activity. You're just going to add 2 minutes to each particular activity that you're doing. That might be enough for a few weeks. And maybe the next week you're going to add 4 more minutes, 6 more minutes. Gradually increase. You want to be slow, steady, incrementally improving the different components of your routine over time. If you happen to be using an exercise machine, there are ways to make very small adjustments in the incline, for example, or the amount of resistance to very slightly increase the intensity in a way that's doable. Not setting unrealistic goals, but again, the mantra of small, steady, doable increases will lead to improvements in the fatigue cycle over time. And the same is true with resistance exercises as well, or maybe even with the frequency. Maybe you're doing twice a week, want to go to 3 times a week. That would be a very reasonable goal as part of an exercise program. There are a variety of different resources. I can help point individuals who are interested in specific resources towards more tailored recommendations if folks want to contact me afterwards. But here's at least a place to start. Obviously, BMT InfoNet has some great resources and recommend encouraging you to check those out. The American College of Sports Medicine actually has interesting and important information on how to find a certified cancer trainer in your area who can help provide a tailored recommendation. And we've certainly done that with our exercise physiologists on a person-by-person basis. That's worked quite well. Livestrong.org has some resources, and don't feel afraid to ask. Many of us, don't have these conversations as often as we should, but if prompted, would be more than happy to engage in them and to help get people pointed on the right track to engaging in a program. So in just the last minute and a half, I'm just going to say about a sentence or two about the long term. We know that transplant late effects can be a real bugaboo for people who have gone through a very difficult process, have ensured long-term health with regard to making an important decision in terms of their disease management, and then having to address or confront late effects that can occur following transplantation. Late effects that can affect many different systems, including cardiopulmonary, osteopenia, immune dysfunction, fatigue, cognition, depression, and even second malignancies. And again, there's emerging evidence that suggests that exercise may actually help in the long-term late effects that might occur months or even years after transplantation. And I think what that points to is that it's never too late to get started, and once you get started, do your best to continue. So just by way of conclusion, and then I'll finish, the transplant process decreases usual physical activity. We think and we're showing that exercise can be safely incorporated at all points along the transplant continuum, before, during, and after transplant. There are some pretty practical, simple steps that one might take to help start and increase an exercise program gradually over time, and I mentioned a few of those here as an overview. Working directly with somebody in your local area may actually help to provide a tailored program for you. And finally, potential late effects after transplant can be targeted and may be reduced or even prevented by an early and consistent commitment to exercise. So with that, I just wanted to thank you for your time and attention. I know that we have some time built into this program for questions and answers. I think what we're probably going to do is I'll see if Tracy would like to say a few words, and then we'll be happy to have a conversation. So thank you again.
Good morning. I'd like to thank BMT InfoNet for inviting me and thank Dr. Wood for giving such a great presentation about how important exercise is to all of us and to all y'all. I'm Tracy Douglas. I'm a nurse from Johns Hopkins. I've been a nurse for 20-some years in bone marrow transplant, and we have been using some of the research that Dr. Wood and others have done to educate and to help people with exercise. And so what we do is we do education before about getting into exercise, getting into yoga. During the process, which is either inpatient or outpatient for us, we also have races for how many miles you can do. I just realized that 10,000 steps is 5 miles. We do it by the mile because we have counted out the miles on our unit. But with more Fitbits around, I think we're going to have to look at steps. And so we do that on a daily basis. We also work with physical therapy every day because we think exercise is so important that we spend 10 minutes of our day working with physical therapy to go over each and every one and how we can get people moving. For outpatient, we have a STAR program. So this is a multidisciplinary program for rehabilitation and survivorship after bone marrow transplant and other cancer therapies. And that is is called the STAR program. It stands for Survivorship, Training, and Rehabilitation. It's run by physical therapy, which can help with fatigue and management of some symptoms, balance and strength, occupational therapy, which can help with activities of daily living, and rehabilitation physicians that can help just tailor a program, as Dr. Wood said, specifically for you. So if you have any questions, I think we're going to sit together. If you have anything to ask. Thank you. Thanks for your time.
So we're here to answer any of your questions. So let's start. Anybody has any questions? So go ahead. Go ahead.
Well, I'm the spouse of someone who is in, thank God, 14 years remission of, thank you, stem cell transplant. So the question actually is not so much for my husband, but for me. But it's fair play, it seems to me. So I walk. I walk everywhere around the neighborhood. And one of the things is walking with weights. My question may sound silly, but do I swing my arms or do I just walk with them? And what are the weights doing for?
All right. So,
Well, weights add resistance. So if you're swinging your arms, you're using muscles to hold the weights, and so that helps as well. Or you can. The more you swing, the more exertion you're going to perform.
Okay, so it's going to help this? Mm-hmm. Okay, thank you.
well, caretakers are just as important. So,
Well,
I said caretakers are just as important. Their health is just as important.
Well, I was going to say, actually, that's a critical issue. First of all, congratulations. It's wonderful to hear. And I think that's clearly something that, as a general point, I think that we're recognizing that we need to really pay a little bit more attention to is how to support, our patients and also their extended, caregiving support network, which includes, spouses or families and friends. And there's a fair amount of, I think, anxiety and other issues that can come up, and we see this a lot clinically, and we think that exercise can have significant benefits for our caregiving support networks as well. And so these recommendations are fairly generic recommendations that could certainly be applied to caregivers too, and I think that's potentially a group that could really benefit.
Hi. In my case, I have multiple myeloma, and After my transplant, well, before the transplant, I have neuropathy. How do I even begin to start exercising when I move 2 steps and I'm in pain?
It's an excellent question.
I walked around yesterday here, and I went home last night, and I could barely contain myself. I was in so much pain. So how do I even begin an exercise program when I have to deal with the neuropathy?
So that's a great question, and I think that it is general as our recommendations may be on a person-by-person basis. People are experiencing different issues, neuropathy included, which can create challenges. And I admit I don't know the particulars of your circumstance. There may be some types of things. If the goal is to increase heart rate, for example, there might be some activities that are going to be easier from a neuropathy standpoint than others. And this may require a fair bit of trial and error to find something that's going to work for you that's not going to end up creating more pain than benefit. And this is not, as I'm sure you unfortunately know, a unique story. We have many of our patients who report this as well, and it may be that perhaps a walking program may not end up being the right one, but there might be others that involve perhaps upper body resistance that may be a little bit better. And so I think the bottom line is it's probably going to be a trial and error process. It's a great question. And it's the kind of thing that, like we do, consultations for anything else in our clinical care, an exercise consultation, for pretty difficult cases like this might be of some real benefit. So I think pointing you towards some resources that can help you find the right activity for you may be helpful.
It is very discouraging, though, because when you try to walk and you feel so much pain, it's very discouraging for you to get up. This morning, I wasn't going to come today because I was in so much pain last night, and I said I'm going to fight it and I'm going to come. But it's very discouraging to want to do anything or to want to start anything, not just the pain, but the fatigue that comes along with it. It's just horrible.
I understand. Thank you for your comments.
Yeah, I would just say when you have symptoms, a lot of symptoms, it's best to go to a professional to talk about your symptoms, and then we want to start with the question in mind: how can I start an exercise program to kind of maybe help with some of the symptoms? But you probably need other things also to help with the symptoms, pain management and other things.
So I have a question for you. Are there any limitations on exercise imposed by lines and catheters that the patients need to be aware of? Because sometimes I tell patients who have catheters maybe not to swim or not to do rowing exercises. What are your thoughts on that? Because swimming might be something that you could try if it's safe to do, and we'll hear.
No, I think that's generally right. I tried to, I don't know that, I was looking for this recently, I don't know that we actually have specific guidelines around that. But I tend to similarly caution against types of exposures that are going to generate significant infectious risk, like swimming and rowing and those kinds of things, or types of things that could actually cause physical disruption to the catheter. And so I think that's again another great question for people who have catheters, just to review the kinds of activities that their physician. And I'll be the first to admit that we have also a lot of heterogeneity and sort of recommendations from provider to provider, because we don't have these specific guidelines. And so, what one person may say is reasonable, another person may have issues with, and it's important to talk with your specific provider to kind of come up with a plan. But I tend to say the same thing that you do. Okay. We have found, though, that people can actually otherwise, undergo pretty, significant exertion with catheters in, whether that's, walking or running, and doesn't seem to pose additional risk, but that's not an endorsed, ACSM, guideline recommendation, obviously.
Because I had a patient who was an avid rower, and it was the most important thing to him in life, and this was a major issue. And as you mentioned, I couldn't find any recommendations. So that's right. Okay, thank you very much. Any other questions? All right, let me ask another one then. Are there any absolute levels in platelets or white cell count that you would recommend patients not exercise at that level? For example, if it's less than 10,000 platelets or less than 20,000 platelets, what are your guidelines at your institution? Or are there any?
For aerobic exercise, we don't really have any guidelines.
Okay.
For resistance training, we do have guidelines when you're less than 20,000 not to do heavy resistance training. I don't know what your guidelines are.
Yeah, I think that sounds about right for what we do as well. And we have participants engaging in aerobic exercise at very low white counts and platelet counts. But I could agree with Tracy that with regard to resistance exercise, we have some guidelines around low platelet counts. That's correct.
In remission for 14 years, in his early 70s, tries to exercise. David's preference is working out at a gym, and he's got a very good routine that a specialist helped him with. But he's still tired, has fatigue, and I wonder how much it plays into David's has multiple myeloma, so he's lost part of his spine. That causes fatigue. But is it also age-related in his 70s? So how does one sort it? Thank you. How does David sort it out?
I mean, I think it's a hard question. It's hard to know exactly what contributes to fatigue, which is, it's a multi-dimensional construct. Many different things can affect it, as you know. I guess I would say only that we do know that age itself doesn't seem to be a barrier to significant exercise. There's a nice piece, I think, in the New York Times a couple of weeks ago about a gym that was mostly populated by individuals who were older and actually engaging in pretty intense routines. I think that, but I think that, as we were talking about before, some days will be better than others. I think the fact that you have got a regular gym routine is laudable and very commendable, and congratulations for doing that. It's a hard thing to stick with it, to do it and to stick with it. I don't know how much aerobic exercise you're doing. You might add a little bit of that, perhaps, if you're not already. But fatigue is a difficult thing to manage, and I guess I might only say that perhaps the fact that you're doing this now is putting you in a better position than you might be should you not be doing it.
Thank you.
How do you incorporate massage therapy into your exercise routines? Is that something that you recommend, or is that helpful for, having that as part of your routine care?
We don't really incorporate. It's not widely available. I think that is kind of the issue. I mean, we did massage. Nurses did massages back in the 60s.
Right.
I mean, we should do it again. But we don't.
You don't.
Really.
Okay.
I mean, it's not a formal part of our program either. It's a service that's available to our patients, but we don't tend to include it as part of the exercise training program per se.
Okay.
But it's an interesting idea to think about again. Again, the cautions around deep massages and platelets notwithstanding.
Right, of course. It's supposed to help counteract fatigue, that's why.
That's right, absolutely. No, it makes good sense.
Okay.
You know, it does.
What are your thoughts on
Acupuncture.
I mean, anecdotally, I've heard there's some literature that it's helpful for symptoms, for pain and nausea, and anecdotally, people that have done it have found, some people have found it life-changing, other people, it's been hard to talk people into trying it, to be honest with you.
Yeah, I feel the same way. I mean, it's not something that we routinely recommend. There are some cautions, again, particularly for folks who may be post donor transplant on ongoing immune suppression with blood count issues and so forth. But so again, it's another one of those things where I would say definitely talk with your healthcare provider team. We don't routinely recommend it because the evidence doesn't seem to be strong. However, just as Tracy has said, we definitely have our share of individuals who say that they've derived significant benefit from it, and so I'm certainly not opposed to it in the right people.
Okay.
Hi, I don't so much have a question as a comment and maybe some suggestions for the lady back there with regards to working out. So I had a bone marrow transplant, survived about 2 years. Prior to being diagnosed and having the transplant, I trained professionally as a dancer for many, many years. So for sure, when I was diagnosed with this and struck with this disease, it was traumatic with regards to the level of activity that I was used to. But I have found that minimal activity, even if, for instance, if you can't walk, a block or whatever, if you walk 10 steps. So every little bit that you can do actually mentally and physically helps. Also, very, very important, stretching. And they reinforced that to me yesterday because I was feeling very, very depressed. Nothing was working for me recently. And I kind of said, oh, well, forget it. I can't do it because of the graft versus host disease. I can't do anything. Well, guess what? 5 minutes, 10 minutes in the morning, if I take that time to stretch, I feel better physically as well as mentally. Now, I'm not sweating. I'm not doing a whole lot of cardio. But every little bit I feel, and I'm pretty convinced that it does help to do that. Also, when I couldn't walk right after transplant, my mom bought me one of these little things, a little cycle thing, and I'm thinking, okay, what a joke. No way am I doing that. It's a total waste of time. I have since taken to doing that again. You're sitting in a chair, so you really feel like you're doing absolutely nothing, and I'll just sit there and you're just doing this. Well, after, again, 5 minutes, 10 minutes, guess what? Work up a little sweat, and you're not doing anything. But I think it all helps to just get us back to the point where we were at some point in time, and I don't anymore put a time frame on it. It'll happen when it happens, and I have no idea when that'll be.
Thank you so much for those comments.
Yes, thank you very much.
Certainly expressed far more eloquently than I could have, and I appreciate that, and thank you for sharing your experience. I can't underscore that enough, and that is, we say that a lot to folks, especially during the transplant hospitalization. Even if you can just, try to get out and walk, one lap, if that's all that's going to happen for the day, you've got to start somewhere, and that's true as well for those individuals who have been discharged and are fatigued as well. And the cycling example was nice. I like that as well. It's actually not trivial. People actually have done exercise interventions with those types of devices, and they work. So I think it's great to hear. Thank you.
So it seems like there are many different types of exercise programs that you can tailor for each patient, and the important thing is to try and to be as active as possible. Any other questions, comments? Do you guys have anything else you want to add? Or
Which specialists would one see to tailor the type of exercise routine?
I'm interested in what you think, Tracy. I mean, I think it's maybe a little bit institution specific. So where we are, for example, I have kind of a personal interest in this, and so I may help a little bit. But we also have a series of exercise physiologists who are very involved with our cancer patients throughout the cancer center, both transplant and non-transplant, who actually have a number of both group activities and individually tailored activities. So if I'm looking for a specific tailored recommendation, I'll often contact one of them who can meet and discuss with one of my patients. We also have for our inpatients, recreational therapy department that can do that, and our physical therapists are very, very eager to participate as well. There's actually a lot of interest now in the physical therapy community for doing both so-called prehabilitation, we're actually trying to boost fitness and reserve prior to therapy like transplant, as well as sort of preemptive or prophylactic cancer rehabilitation, not for people who would otherwise sort of need to meet traditional physical therapy referral guidelines, but rather, anyone who has undergone a transplant knowing that, these kinds of exercise programs can be helpful. So, I think that's where that field seems to be moving. And so there's a variety of individuals who may be able to help depending on local environment.
Yeah, and we have a rehabilitation program for survivors that is run by rehabilitation physicians and physical therapies that specialize in cancer survivors. And so they've worked with oncologists to kind of determine what are the best modalities to what exercise programs.
She has a question. She has a comment. Right.
And I can add one more thing to that, too. In your local communities, Live Strong is excellent. I did join the Live Strong program in my community. I'm in Westchester, New York, and Rye. They have a Live Strong program. Now, it was a little bit too quickly after, so I wasn't able to complete it because a lot of times you're sick, but it's an excellent program, and they start very slow. They do an assessment, and it's all cancer survivors, so you're only with cancer survivors. They start very low, and then they build up, and I think it's 8 or 10 weeks. It's a pretty long program, too, if you're well enough.
Yeah, so your local physical therapists in your hospitals and in areas where this is not very specialized is a good resource. Also, I've actually spoken to a lot of physical trainers or coaches who are now working with these patients, and then they will, if they're working with a patient who's a cancer survivor, they usually call me, and then I talk to them about some of the limitations of their blood counts and stuff. So I know there is a lot of interest out in the community, in physical therapy world, and even in physical training world, of awareness of cancer survivors, and people are very willing to work with you, and I'm sure there's training programs specifically designed for that in terms of coaching and stuff. So, okay. Tracy, do you want to add anything else as a comment?
Thank you.
Okay.
Thank you
All
very
right.
much.
Thank you very much for attending this session, and thank you, Dr. Wood and Tracy.